I'm very addicted to the treadmill, to cardio especially. I'll do like a couple classes at the gym and then I'll hop on the treadmill or vice versa. And I like to lift little weights, not too much. I'm very healthy, yes. I knew I was born with a heart murmur. They told me I wouldn't have to have the surgery until I was in my 60s, but it got worse. I was always tired. I would force myself to do 6 miles. Carrying laundry, I got fatigued. Going upstairs, I got more fatigued. And it's like I noticed a big difference, as I got older. So I go to my heart doctor and I tell him this, listen, I am always tired. I'm tired of being tired. So they wanted to do a cath on me. So they did a cath and the cath wouldn't go through. And that's when they told me I had to have the surgery done.
She was referred to us for definitive therapy for her valve replacement. She had a bicuspid valve that it was abnormal, if you want to call it. However, 20% of the population probably has bicuspid valve, and that does not pose them any risk, that does not pose them any problems. The problem happens when a small percentage of those bicuspid valves start getting either calcified or the tissue starts degenerating and they start leaking. And at that time, if the symptoms develop, they would need something done.
I was scared at first, but my trust in Dr. Mumtaz was, I really trusted him. My husband really liked him a lot. He's like, this is a good doctor. He goes, I think you'll be safe. So I'm like, okay.
In this procedure, we make a 1-inch incision on the side of the chest and we go in between the ribs. We don't have to cut any ribs, cartilages, or go through a major muscle group. However, the valve that you have to put in through that less invasive surgery is either a cow or a pig valve, which may last you 10 to 15 years, give or take. On the average, patients go home in approximately 3 days and their recovery is quicker.
I had my surgery at UPMC Harrisburg. I expected to be in there for 4 days, but they cut that in half. They got me out in 2 days. I walked with a walker one time and I was walking on my own, so the recovery was easy and faster. I was back doing the gym and doing my treadmill 5 to 6 weeks. I have more energy. I don't have to push myself. So, yeah, and I go to the gym, like I do a couple classes.
I wish all my patients are like Paula. It was a real pleasure to take care of her and then see her recover that quickly from the operation. It's always very satisfying to see your patients recover and doing well and feel better than what they were before.
He means everything to me. He gave me my life back. I would recommend him to anybody. I just feel very blessed, very blessed.